Okay, we're continuing with the book Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. If you're following along in the book, we're on page 72. Right here, that's illustration 219, the dietary nitric oxide pathway. So basically, when you eat greens, they contain nitrates. That's NO3. The NO3 goes to the back of your tongue, so it's good to chew it well, where there's bacteria that convert the NO3 into NO2. NO2 is a nitrite. In the drawing, I forgot to correct the spelling. It's nitrite. So that's NO2, nitrogen bound to two oxygens. Then it goes down your esophagus into your stomach, and the stomach acid helps convert it into NO, as in nitric oxide. The nitric oxide goes into your blood, and it causes vasodilation, opening up the arteries, systemic vasodilation. So that's why eating greens is so good for you. Things to watch out for. You don't want to use fluoride toothpaste or fluoride mouthwash because it kills the bacteria on the back of the tongue, and then you won't be able to convert the nitrates to nitrites. So that's why fluoride toothpaste can increase your blood pressure, okay, because you lose the systemic vasodilation that you would get from the greens. Proton pump inhibitors decreasing stomach acid can also decrease the ability then to make that next step in the conversion from NO2 to NO to nitric oxide, okay? So that also could increase your blood pressure. You also can get systemic vasodilation by going out in the sun. You have nitric oxide precursors in your subcutaneous tissues that get released when you go out in the sunshine. That's why sun feels so good. And you walk out and you get this whole total body vasodilation, good feeling. Peter Cole was a cardiologist in Pennsylvania in the 1950s, and he fed his cardiac angina patients a high-fat meal with saturated fat. And then he checked their blood lipids every 30 minutes. Excuse me. At 3 to 7 hours, they would get episodes of cardiac angina, peak lipidemia, when the fats were highest in the blood. Other people thought, well, gee, Ansel Keys, Peter Quo, they've shown that saturated fat is bad. We now know that saturated fat is bad for blood flow because they stick the red blood cells together. It's called blood sludge, rouleau formation. I'll put a link to Dr. McDougall's video in the description below, where Roy Swank had fed a high-fat meal, and then the red blood cells all clumped together. There's a whole bunch of research that's been done on this. What they tried then was with the PUFAs, polyunsaturated fatty acids. They tried that in the 1960s, and they found it did the same thing. Okay, you get blood sludge. PUFAs are like omega-6 cooking oils. Ray Rosenman, Meyer Friedman did those experiments. They were ophthalmologists. They put an 80-fold magnification microscope on the patient's eye, and they could see blood vessels sort of disappearing. The blood was like partially precipitating, partially clotting, and you couldn't perfuse some of your capillaries, for example. At peak lipemia, Peter Quo measured 15 to 20% drop in O2 pressure, in perfusion professor from oxygen, and Roy Swank in a hamster brain got a 30% drop after a high-fat meal. So it's bad. So yeah, here's the numbers. That means you're dropping oxygen delivery to your tissues. That's a problem. Okay, the higher the hematocrit, the higher the blood viscosity, the thicker the blood. Okay. Because most of the blood cells are red blood cells, over 99% of them. Okay, there's not that many white blood cells. White blood cells are bigger, but there's just not that many of them. The percent of red blood cells, in the blood relative to the amount of plasma, that's called the hematocrit. The higher the hematocrit, the thicker the blood, the higher blood viscosity. Because women menstruate, they lower their hematocrit and they're less prone to hypertension. When somebody smokes cigarettes, the cigarettes cause hypoxia, poor oxygenation of the blood in the lungs, so they get a compensatory rise in their hematocrit. Smokers. Not a good idea. The long-distance bicycle riders who took all that EPO to raise their hematocrit because that raises blood cells, red blood cells, a lot of them died of heart attacks because the blood's more prone to thrombosis when you have a real high hematocrit. You also get more hypertension. That's why women have less high blood pressure that are menstruating, premenopausal, because when they menstruate, it lowers their hematocrit. They also get more immature red blood cells coming out of their bone marrow to replace the ones that they just lost by menstruation. And those are more deformable, more flexible, because red blood cell outer plasma membrane gets less flexible as the cell gets older. That's why as it gets older towards 120 days, when it's typically removed by the spleen, it can no longer pass through the small splenic sinusoids of about 3 microns versus typical capillaries about 5 microns. Red blood cells about 7 microns. Those are numbers worth knowing. Okay, in the movie Game Changers, nice picture of what happens after you eat a high-fat meal. Your blood plasma becomes opaque. Normally it's translucent. You could see through it, okay? After this, it becomes opaque. So what is it that raises blood sludge? And again, I'll have the video below that you can link to. Elevated dietary fat causes increased chylomicrons will stick the red cells together. LDL cholesterol will stick the red blood cells together. Triglycerides will stick the red blood cells together. They're all bad. So what's the moral of the story for this session video today? Is you want to eat a low-fat diet. There's just nothing to be gained by eating a high-fat diet. There's really rare circumstances. If you got a refractory epilepsy, high-fat diet slows the brain down a little bit. And for some people that helps, okay? But regular person, they don't want to slow their brain down. They want their IQ, their thinking ability to be as fast as possible. So anyways, I hope you found that helpful. I'll have the link to the McDougall blood sludge video below.